that yesterday. Please, let's mute our mics. Please, let's mute our microphones so that we would not have the obstruction. We trust that God would make it easier today. We do not have network issues. Please, are we together? Can everybody hear me?
Yes.
Yes.
Okay. Please, intermittently, I'm going to
Yes.
ask so that I know the people that are following and those that are not following. Hi, Jovita. Hello, Jovita. Okay, maybe she's somewhere where she can't really hear us. So yesterday, close that. Yesterday we had some modules. We actually took the first 3 modules, which is Introduction to Healthcare, Basic Healthcare Skills, and then Infection Control, Health and Safety. And I want to appreciate those that took time to put in a word or two in the general group. I want to say a very big thank you from Ijelma, Madam Ijelma. That was the first. Afterwards, I saw Mildred's comments and Kate's comments as well as others that I have not actually looked from that time. So I want to thank those. But we have a lot of people that have not actually completed the assignment because that is an assignment. So I was checking if the assignment was actually done. Okay, Abolari Abidemi, it's nice to have you here. You're welcome. I've just read your greetings from the chat. So
Good evening, ma.
Yes, it's nice to have you, Abidemi. Thank you for being here, for trusting us to pass the same road that you passed before. Thank you so much. Okay, so yesterday practically we talked about the introductory aspect. Like I told you that yesterday was introduction, and as we progress, we'll have to delve deeper into what this training actually talks about. So before I continue, I'll just want maybe 1 or 2 persons to tell me something. Just give me something, not the persons that answered yesterday, please. The people that did not say anything. I'd like to know one thing that resonated with you yesterday, one thing that you learned that you didn't know up until yesterday, or even the one you knew and was reinforced yesterday. So I just want to hear one person say that before we proceed and have a review of what we actually did. So who is going to help us at this juncture? Someone should help us. Who is ready to help to build a cat? It appears I am not even audible. So, is there anyone ready? I can see. Hello, can you hear me?
Yes, ma'am.
Okay. Because it's unusually quiet. So please, who is going to help us? Just in one sentence, one thing you learned yesterday. If nobody is saying that means that means I don't know, that means yesterday was futile. So I just want to have a kind of evaluation of what we did yesterday. So who is going to help us? Infinix. Okay, Infinix X6517. I thought you wanted to say something. Who else would help us? Just one thing. So it means we didn't learn anything here after all yesterday. Should I go ahead? As nobody, okay. Someone,
Yeah.
I think that's Abolarin trying to.
Yes.
Okay, Abolarin,
yes,
please.
Ma.
Thank you for not making me
one of the things
sad, at least.
Okay, sorry, ma. One of the things that I learned yesterday is about hand washing. You know, before I don't know that it's very, very critical to be washing hands. You know, it looks very not comfortable to be coming out, going out and washing our hands all the time. But through the lesson that we had yesterday, I saw that a part of the hygiene practice is to wash and thoroughly all the time, or by using sanitizers, then just to maintain cleanliness. That is good.
Wow. Thank you, Abidemi. I am satisfied because I was almost getting sad when I asked and nobody wanted to answer. I was like, oh, was I just busy doing nothing yesterday, and there's nothing as bad as you thinking you are doing something, and at the end of the day, you've just been busy doing nothing. So thank you. I guess others will respond as we progress. Thank you, Abidemi, for that beautiful feedback. So primarily, without wasting time, I was trying to see how to buy a little time so we can start exactly 5:15, so that others can join us. So yesterday we talked about, we're just going to have an overview of what we did yesterday. We talked about the different healthcare environment settings. We talked about the primary, the secondary, as well as the tertiary care or health settings. And we explained the difference, that one is the first point of contact, the other one involves specialists, and the third one is the one that talks about advanced surgical procedures, where someone is recuperating after an operation or something. So we also looked at the roles of different people in the healthcare team, the roles of different healthcare workers. Someone's mic is still on and is interrupting us. Now, importance of care assistants, we did say that as a certified healthcare assistant, you have a big role to play. You have a big role to play. Good for those people even that have taken the certified nursing assistant training and they are taking this as well. It means all round they will be grounded. All round they will be grounded. And even people that are just taking this HCA training as well. You are quite fortunate. So what we are trying to say at this point is, as a CHCA, a certified healthcare assistant, you are very, very important. You are highly invaluable in the health team because you have you interface with the patients regularly. You have this, you should have this bond, this connection with the patients more than the other members of the healthcare team. The other members of the healthcare team, it's very, very important. So, as such, we should play our role well and know exactly what to do. So we talked about the healthcare skills, the personal skills, the things you are expected to have, the skills we are expected to have to be able to attend to these vulnerable people, to be able to take care of these patients. We also looked at infection control, which buttresses what Madam Abolare Abidemi just said. Hand washing, infection, what does it mean? How do you guard against contacting infection or spreading infection? We looked at it yesterday. We looked at the chain, the chain of infection. We looked at the 6 points under the chain of infection, and we did talk about it. We said hand washing is very important. We talked about the portal of exits, how this bacteria, how it goes out, through which means does it come out. That's the portal of exit. You know, maybe when you vomit, when you saliva, fluid, and so on and so forth. We looked at the mode of transmission too. Direct contact, droplets, bloodborne, through the blood, airborne, vectors, and so on. We looked at all those things. Portal of entry to and the hosts. We also highlighted how you can break this chain of infection, how it can be broken through you taking care of your hygiene, ensuring that you do all the necessary things you need to do. Proper hand washing, use your sanitizers, keep your environments clean, understand, keep yourself updated with the latest trend in the field of health, because when we get to professional development, we'll talk extensively into that. So when you keep upgrading yourself, you keep yourself abreast with what is actually happening in the health field. Okay, so having said that, we looked at the protocols to emergency protocols, engage in fire drills, and so on and so forth. So today we want to talk about patient's communication skills. That's going to be number 4. Number 4 on our course outline, number 4. So when you look at it, you would see patient's communication skills. Now, let us imagine, let us ponder. I need to know if we are together, because now we are getting into the business. Yesterday was just the communication is important in all facets. Even in the house with your family, communication is important. With your spouse, communication is important. At your workplace, communication is important. Please, are we together? Can everyone hear me?
Yes, ma. Yes, mommy.
Okay.
Yes, ma.
Yes,
Okay,
ma.
so nobody reminded me. I think let me put it in slideshows. Forgive me now that we are starting. Good. So let it be in slideshows. It's very easy for us to see. All right, I think that's fine. So patient communication skills. Communication, like I said, is very, very important. Anywhere you go, you must learn how to communicate. For you to be an efficient caregiver, communication is top key. Anything you do, whether it is in business, you have to learn how to communicate because people are different. There's what we call individual differences. The way I feel, perceive something may not be the way Gifts or Sareme perceives her own or her own perspective concerning that. The way I react to something, I may be a person that maybe I just react. We have different temperaments. Maybe I'm very impulsive when I react to things. As it happens, I just give it to the person, but there are some people that are calm and they take their time. So just as people are different, so we need to learn, we need to go extra mile to learn how to communicate effectively with them in order for us to get the best out of them. It's just like in this class now, we have people of different temperaments, people that react different. There are people that may not want to speak out when you ask. It's just their nature. Maybe they don't like to talk, you understand, but they are actually they're actually involved in what you are doing. There are those that will just answer. It's just like in a full class setting, they will answer, even if it's correct, they'll just want to be part of what is going on. So people are different. So for you to be able to really do this, function effectively in this field, you have to learn how to communicate. Very important, because the skills you will learn here, thanks to one person that dropped something like that, the skills you will learn in the course of this training would help you in all facets of your life. The training is not just all about you going to be a caregiver per se at the end. No, it will help you if you imbibe all the skills. 3/4 of the skills will help you to interface with people in your workplace. You begin to loosen up. You begin to learn how to relate with people. So now let's bring it down. Let's narrow it down to the health sector now, because that's what we are doing. That's what the training is all about. Now, I want us to imagine, just imagine a patient sits before you. Let's imagine that you are a healthcare, like you can see that beautiful lady and the elderly lady. Now, a patient sits before you, eyes filled with fear. Maybe the person is anticipating something. The eyes, you looking at the person's eyes, the eyes is filled with fear and uncertainty, as it comes with people that may be expecting to hear a result, or people that already have the background feeling that something is wrong with their health or something. Maybe you sit with such a person and you see that the person is afraid. There is fear, there's uncertainty of not being able to decipher and know what would be the result. Oh, how am I going to cope with this illness I have? What's going to become of me? How is my life going to be? And so on and so forth. When someone is ill, when people are vulnerable, they have fear, they have anxiety, they have fear, uncertainty crops in. So if you have this scenario of maybe you sitting or a patient sits before you and the eyes is filled with fear and uncertainty, this is what I want you to understand. As a certified healthcare assistant or as a health worker working in the health team, you have the power, you have the 100% power to transform that fear that you are seeing in that person's eyes into trust with just a few words. I don't know if we understand. Please let's be very particular and listen, because this is the heart of caregiving. In fact, this is the heart of any relationship, communication. So you as a health care assistant, you have the power, you have all it takes to transform that fear that the person is having into trust with just a few words. So effective communication is not just a skill. I want you to understand, it's not just a skill. It's the heartbeat of patient care. Anytime or anyhow, be you a nurse, be you a doctor, be you a certified nurse assistant, be you a caregiver, be you a healthcare assistant, it is important for you to note that the power is in your hands. You have so much power. And it is important that you understand how effectively you can use that power to your own benefit and to the benefits of your patients. That's what I'm driving at. So today we are going to unlock the secrets to connecting with patients on a deeper level. ensuring that they feel heard, they feel understood, and they feel empowered. These three things: heard, understood, and empowered. These are three things that are very, very important. And I believe that we are actually ready to set the ball rolling. We are ready to make a lasting impact in this field. I believe so. So let's look at what we have. Importance of active communication in healthcare. The importance of that cannot be overemphasized at this point. You cannot just throw it away, if I'm permitted to use that. Now, when we talk about listening, there is a difference between listening and hearing. I want us to first know that someone can just, I can bang this table, like I know we can hear. You have heard me bang the table. Because your ears are where it is located, you can hear as I bang the table. But listening is a calculated attempt, is an extra effort for you to understand what a person is saying, listening. And they cannot be effective communication if you don't listen. It goes together. It works pari passu. It works hand in hand, listening and hearing and communication. Everything put together makes the communication process very, very important. Okay, so now we are going to, in the next few minutes, we are going to look at this importance. Why is active listening important? Why do we need to communicate? These are things why do we even have to listen actively in the first place? This is what we need to know. All right. Okay, so now one of the things that active listening does is that it helps you to build trust. It helps you to garner trust. It helps you to build trust between healthcare providers and the patients. Remember, yesterday when I was talking, I kept telling you that I kept making reference to that fact that trust is important. For you to be able to communicate, you have to trust a person. For you to even patronize a person, for you to even engage with a person, there has to be a level of trust. Now, building trust between healthcare providers and patients is very, very important. That's number one, importance of communication in healthcare. Building trust. It is important that you communicate effectively with your patients so that you'll be able to build that trust. And with trust comes a whole lot of things. If you relate it to the normal day-to-day life or your relationship with anybody, you know that trust makes you open up to the person. Trust makes you could even confide in a person based on trust. Trust is very, very strong. It cuts across anything that we do in our lives. So as a certified, I beg your pardon, as a healthcare assistant, it is important that you build that trust between your patients. You have that trust. When you relate with them, let your yes be yes, let your no be no. Relate with them in such a way that they know that you've got their back. They know that you have that empathetic side. And with time, the trust is built. That is one. Now, another very important thing, like when we talk about, I was just talking about trust, because when you trust, it helps that trust will help the patient to get better health outcomes. It results in positive health outcomes. Because if you are dealing with a trustworthy person, if you are dealing with a person that has given you a shoulder to lean on, over time, it makes the patient to loosen up. It makes them to be relaxed, and they can tell you anything. You can walk a mile into their lives and know exactly what happens to them at any point in time or what they are going through. They feel comfortable to talk with you. Another point, another very important point is it enhances patient satisfaction and compliance. When a patient is satisfied, it's very easy for them to comply with anything that they have to do, taking their drugs, maybe anything that will help in making them get better. It helps them to comply. It just makes them comply. It's easy. So it enhances their satisfaction. It makes them to comply with any instruction that is given in the course of giving them a care. Another very important point is the emotional aspect of it. Like I said, patients, I don't know how to explain this, but I'll try. You know, people that are not fine, people that are passing through, that are vulnerable, that have issues, they get emotionally broken most times because of what happens to them. So as a as a HCA, the emotional aspect of it cannot be rolled out. You cannot just take the emotional aspect of it. So one of your duties is to ensure that you give them that shoulder, you give them that emotional support. Let them know that you understand what they are actually feeling. Talk to them because you are human, they are humans. So relate with them. Over the years, we have seen a whole lot of things, like one of us said yesterday. When you get into a hospital setting, especially those of us that are not yet into the health, maybe we just want to take this training as a foundational stage for us to delve deeper into the health sector. You'll understand what I mean. When you get into the hospital, you see the way some healthcare practitioners treat patients, you weep. Being in this particular business, I have seen it firsthand, how these things happen. And sometimes I just wonder how people mistakenly get themselves into the health sector. Because if you are a person that cannot feel another person's pain, and you cannot learn to feel another person's pain, then you should not be in the health sector. This is very important. Like I said yesterday, that we must prepare our minds, we must prepare ourselves and be ready for the journey, because it is indeed a journey. It's not a walk in the park. It's a journey, and perhaps a long one. So we have to prepare our minds, prepare our spirits, prepare our bodies, restructure our mentalities, and then wear in that humanitarian dress, and then we start. With that, we'll be able to conquer anything we see on our way. So emotional support. Some may cry, some of the patients may cry, some may go depressed, get into depression. You may see forms of different types of illnesses and different forms of vulnerability in the course of you doing this work. So that emotional support is very important for you to be able to communicate effectively with your patients. Good. It also improves health outcomes. I've said that over and over. This course, most of the course outlines interlock. They just dance around each other. The ones that are very important, you would see that it cuts across, like this communication cuts across a whole lot of things. Now, it also makes your job easier, especially for those of us that, God willing, maybe wish to actually do the paid part, the paid aspect of this job. Now, it is important for us to know that communication goes beyond merely hearing words. And maybe someone just talking and you just listen. It goes beyond that. Oh, I've heard you. No, it goes deeply beyond that. It involves a conscious effort to understand. You make it a conscious effort that you consciously try to understand what your patient wants. You engage with your patients and you respond to what the patient is saying. Sometimes we have people that are actually very rude in this profession. Sorry to use it. They are actually very rude because they talk to their patients anyhow. They respond anyhow. And I understand that we are humans. Healthcare practitioners are human beings, just as every other person. So they are not God, or I don't know, they are not God. So they have their own feelings and emotions. That is why it is something you have to take your time to learn, to make it a part of you, because you are definitely going to face some situations where you see people, like I said, individual difference. People will want to bring out the worst in you. They just want to bring it out. But if you have your onions, like you know what exactly you have your skills, you have all the tips you learn, it's very easy for you to overcome such situations, because of course you would come face to face with them. You come face to face with them. For example, maybe a patient who feels comfortable discussing symptoms is more likely to provide accurate information, leading to better diagnosis and treatment. A patient that feels comfortable will tell you anything. Like I said, there are some things that are embarrassing. People don't know how to talk to strangers. They don't know how to say, maybe I'm feeling this, or I'm feeling that, or this is happening to me. like I talked about urinary issues yesterday, that something like that, you see that people, especially women, they wouldn't just want to tell you how they are feeling. They may feel embarrassed, feeling, oh, why is this happening to me? But it is in your place. If you communicate effectively, if you know what to do, the emotional support, the physical therapy that you can give is for you to ensure that having built that friendly environment for this person to be able to reach out to you, you try also to ensure that the person is comfortable talking to you, and you reassure the person, let the person know that it is not only you, it's not happening to you alone, it's something that can be handled. Do not worry, it's not embarrassing. So many people face this. We can work on it, we can do this, we can do that. When you say those words, they are reassuring. It reassures your patient. And tell me what that kind of behavior, tell me what that kind of patients rather would want to keep away from you. No, because he or she knows that certainly they can lean on you at any time. So practically, this is the importance. That is the importance of active communication, active listening, of communicating, effective communication. So a communication has to be effective, not just it being communication, but it has to be effective. So let's run to the next slides. Let's get to the next slides where we have the types of communication. But can we go ahead, please? Is everyone together? I believe now we should be up to our exact number.
Ma'am. Yes, ma'am, you can go ahead.
All right.
Yes, ma'am.
Thank you for those that are responding. And thank you too to those that are
Sorry, yes, ma'am. Sorry.
those that are on the way. They are on the road to responding. Okay.
They are responding.
All right. So
I'm
let's
your place, so
let's
I
go
barely
ahead.
talk. I just
Okay. So let's look at types of communication. Types of communication. There are different types of communication. We have the verbal communication. Now, when you are talking to someone, I like to, whenever I am giving a training and I get to communication, I take a longer time. So please bear with me. The reason is that communication is the heart of anything and everything. So I am going to take a longer time in talking about everything that needs to be talked about, because so many people have lost their license, their license have been withdrawn. So many people have had to be on the other side of the law because of this particular lack of communication, of communicating effectively. So many people have been jailed. So many people have been sued. I mean, it's a whole lot. So when I come here, I try to, since we are going to be caregivers, I try to delve into it take it extensively so that we will understand. Now, when you are talking, your tone as a caregiver, as a health care assistant, you are there to render care. The way you talk matters. Verbal has got to do with talking. Verbal, as we are communicating verbally, because you can hear my voice. You know when I am down, when I take my voice up, you know she's emphasizing what she's saying. When I bring it down, you know that there's less emphasis. So tone of talking is very, very important. Those of us that are English majors will understand. We have the rising tone and the falling tone. There is how you respond to a person that shows a weak response. Weak response. Okay, will you like to take that? Okay, fine. You can see that. That's a weak response. Fine. I'm just saying it. Okay, I'll take it. But someone comes to me and say, oh, Dr. Dorothy, would you like to take this? And I say, oh, yes, of course, I would. You see, there's a difference between that two. Anybody hearing will know the second response, that I'm excited. I'm eager to take that particular thing. But the first is weak. So why am I stressing this? Tone is important. The way you talk to someone sends a message to the person. You can talk in such a way that the person understands it as insulting. The person understands it as you not showing respect. The person understands it like the person takes it to be as if you do not have value or you do not value him or her. These are things we need to understand. So verbal communication is very important. When you talk, take note of your tone, especially to vulnerable people. People that are vulnerable, they are very sensitive. Never allow anybody deceive you that a person is ill. Maybe a person has this illness, and you think that the person's part, that part of the person, that a person cannot decipher between an insult and respect, will be taken out. No. So in the course of your job, try to ensure that you maintain a good tone. Today's training is packed. We are going to get to watch a video. I think one or two must have seen that video if they've done seen it. The reason I didn't want to pick out another video is that particular video will teach you a whole lot of things just at a glance. Anything I forget to tell you is embedded in that video afterwards. So you'll get to understand. Now, and then clarity. When someone is talking, when you are talking to your patients or communicating with other members of the healthcare team, ensure that you do it with clarity. Don't be ambiguous. Let your statements not be ambiguous. Let them be simple statements and with clarity that at least a person can just understand. And the pace of your speech. When you are talking to a vulnerable person, try not to be as fast as I am doing. Normally, I talk fast. That is the way I am. So try to calm down, take your time, because these people are vulnerable. You know, you have to take time and explain to them with love, with patience. This is what should be done, or is this what you want? Respect them, give them the respect. Take note that at that point, their self-esteem naturally is being affected because they are vulnerable. So naturally comes with some level of self-esteem going down. So do not compound the challenge that they already have. So when talking to them, your pace of speech, your clarity, your tone, they are very important in the verbal communication, just as I am communicating with you verbally. Now we also have the non-verbal communication. Excuse me. The non-verbal communication has got to do with your body language. How is your body language? People don't understand this. This is another aspect. The way your body, as you talk, your body has to align with the way you talk. If you're a good communicator, your body has to align, because people read, they say action speaks louder than words. So that's to tell you that non-verbal communication is even more powerful than the verbal one. You can communicate anger non-verbally to a person, and the person understands it even more than you orally saying that you are angry, or orally abusing or talking using abusive words. So our body language matters. It's just like a child. If you send your child, send your child on an errand, and the child just maybe his face, from the face, you see, maybe for a child that is sometimes a little bit naughty, that doesn't want to go for that errand, you see the face, you see the posture, you see even the reluctance already communicates to you without the child even saying, no, mommy, I don't want to go on that errand. Without even the child saying so, you have come up with the fact that this child is not happy to go for this errand. So what am I saying? When we are communicating with our patients, we should ensure that our body language aligns, because they are looking at us, they are reading us. There are many things that make you to bond with a person naturally, many things that make you to bond, especially a person that you are seeing physically. There are many things, maybe the way the person behaves, the way the person gives you full attention, listens to you. The body language alone of maybe sitting down close to you, listening to you, looking at you, already sends a message to you that, wow, this person really values me, really respects me. So that's how you should liken it into the caregiving scenario. When you are taking care of these people, eye contact is important. Facial expressions is important. Is your face always approachable? Are you readily approachable? Do you have an amiable disposition? Or are you the one that maybe for us women in the house, you had a challenge, you know, your husband did not, maybe you asked for feeding money and he didn't give you, and maybe he upset you. You know, we women, we understand these things. And so you now take it to work and transfer the aggression to your patient. You understand? So, and then you transfer the aggression, your face is already in a tumulted situation, is already contorted. So when you are there talking, your patient is trying to communicate something and your face is like, do not disturb me. Oh, what the hell? Why are you disturbing me? Or I just need my peace. What is wrong? You know, all these things. So why am I saying these things? I'm taking time to explain, because we've had people being repatriated in the course of their duties. Some of them have lost their jobs, their caregiving jobs. Why? Because attitude is everything. Attitude is everything in life. Attitude, your attitude matters. So because they didn't follow the right channel, they did not learn and learn well. That's what happened. So But I thank God for the professionals on the stage that none of us will be MJB Management and Andy Smart Solutions, BCC UK would not be disappointed in us. I believe so. So your facial expressions matter in everything you do. In your workplaces, you may not end up being a caregiver. In your family, in your marital business as you go along, even anywhere. So it's important. So again, we also have the written communication. We finished talking about the verbal, the non-verbal. Now we have the written communication, the patient's education materials, notes. It is not all the time. You can have situations whereby parents cannot, patients, I beg your pardon, patients cannot coordinate. Here, they have hearing impairments, impaired hearing. They cannot hear you when you talk. So in such situations, you need to have a plan B, or the organization, the facility always keeps a plan B where you need to communicate with your patients. It could be through electronic communication. It could be maybe education materials. Patients, you give them materials, you know, to communicate. Maybe they could write, but they cannot hear. You too could write, pass across your information in a written form to them. So that's written communication. So practically, in a nutshell, each type of communication plays a critical role in how messages are conveyed and understood. All this type of communication plays a role in how patients and people understand you and you understand people. Is vice versa in a healthcare setting. So that having said, I don't know. Let me get back to see how many of us are here. Please, can everyone hear me? Are we together, please?
Yes, ma, we are.
Yes, ma'am.
Yes, we can hear
Yes,
you
we
now.
are.
Okay,
Yes, ma'am.
I know some of you are enjoying what I'm saying. The truth of the matter is, those that have been in my trainings, there are some areas that I'm very emphatic about, and I emphasize, and I tend to talk too much. But I pray today God will not allow me to talk too much and we exceed the time. So, having said that, these are ways that we can communicate, and it is very, very important that we learn this way. We talked about communication, active communication. Now, for instance, let me give you an example. I was talking about the tone. Now, a warm tone during a conversation can reassure a patient, while a poor posture may convey disinterest, just as I already said. So you can talk in a warm tone. Oh, I understand how you feel. Oh, never mind. I'll reach out to the doctor to check what you actually want. You know, there is how you talk to a person. You soothe the person's pain even before the person is actually treated. Your manner of talking to your patient can actually soothe the pain and reduce the pains before that person is actually treated. So you see how powerful healthcare assistants are. People in the healthcare team, how I wish that everyone would have this training, or maybe everyone would have the right knowledge. I tell you, our hospitals would have a form of a revamp. Everything would just fit into play, because the challenges every day, the ones I see and the ones I don't see, it's appalling when you see some of these things happen. So at this point, we have talked about communication, how it can affect, how it can influence how it can influence us. So now we are going to look at barriers. Even as I am talking and talking like this, it is not easy. It is not easy to be a healthcare assistant. It is not easy to be a caregiver. It is not easy. I keep saying there is not a walk in the park. You are going to be faced with, of course, that's why you need a training. With the training, you'll be able to surmount these obstacles. You'll be able to surmount this hurdles that you are eventually going to have, because there are barriers. There are people naturally difficult. They are naturally difficult in nature. That's what I mean by naturally difficult. So with the onset of illness that would be relegated to a particular place, maybe in a facility or in the hospital, So what can you do? There are barriers to effective communication. You must try as much as possible so that your job can be easier for you. You can make yourself happy. You can make your job easier for you. You have to see how to learn how you can surmount those obstacles, how you can actually surmount the obstacles that you would face as a healthcare practitioner. Now we have the language barrier. That is one of the obstacles that you'd have. Language barrier is a very, I don't know how to put it, but very, very great obstacle that you may actually face, language barrier. Now, you may find yourself in a place where they don't speak your language. For instance, we've had a couple of people that have taken our trainings, I think about 3 precisely, that have had to, God willing, they were able to go through the links, and then one of them in particular reached out to us in the community they belong, reached out and expressed the challenge she had. And the challenge to greet me. That is because that is their own cultural, that's their own culture. Let me just leave it at that. That's their own culture to do just that. You understand? But over here, we don't value that. So people are different. There are cultural differences. In some cultures, a younger person, you don't, no matter what, be you a caregiver, be you whoever you are, you don't maintain eye contact with an adult. You don't look into the contact or into the adult's eye when you are talking. It shows disrespect. It shows disrespect in some for some cultures, and in some other cultures, it shows that you are fully attentive. So as a caregiver, most of these things is not cast on concrete. You'll have to understand cultural misunderstandings or cultural issues, that come as a barrier. So you have to see how to surmount that particular aspect of it. Again, some of the barriers we have: emotional states, emotional conditions, anxiety, fear. With people that are vulnerable, there are many things. There may be those that I have a friend that whenever she's down, she just screams. Even when you go to her, the worst thing you can do is to go to her when she is in that mood. You go to her to say, oh, hello, what's the matter? Why do you sit like this all on your own? Are you sure you're okay? She will just scream, leave me alone. She will just, do something that you. So by the time we got to know her, we now devised another means of breaking that particular challenge that we had. You understand? So people are actually different. Sometimes when you could have anxiety stay as a barrier, you cannot communicate because that person is overly anxious and doesn't want you to break the results that the person or the patient already has. Or fear as well. These things can stand in between you and your effective communication to your patients. But however, look at it holistically. Look at the bottom line is you just need to communicate effectively with your patients, which is one very important thing. So you have to try to break the results. You have to try to break the barriers so that you can move on. It is important that we know these things. Also, physical barriers too, hearing impairment. Like I said, when you observe that your patient does not hear, maybe those that actually have dementia or have the Alzheimer's disease, and it gets to the point whereby you cannot really handle it. It affects their ears. So they need a hearing aid. They can only hear you effectively with their hearing aid. So you as a healthcare assistant, you have to ensure that their hearing aid is properly fixed. Sometimes maybe due to one thing or the other, it can shift or it goes off and you can talk till tomorrow. They wouldn't understand what you're actually saying. So these are some of the barriers that you have. And then lack of time as well. Lack of time is another one. Healthcare practitioners, nurses, certified nursing assistants, HCAs, caregivers, we have one challenge, some of them, because it's not all, and that is lack of time. patience. They don't have the patience. You are always on the run. For instance, you are in a ward, maybe a facility where you have to attend to several people. Of course, you would not want to use all the time. You see all these things I'm saying, listen emotionally, give a shoulder to lean on, empathize, and talk to the person, do this and do that. It actually takes time. So for you to function effectively, you need to practically, you need to actually have that time. And the time is not there. So that's one of the barriers that we have to effective communication. We have that barrier of time. You have to attend to so many people. And so you just need to get instruction there down to maybe Mr. Paul and move to Mr. Peter and then move to Mr. Jackson, just like that. You just have to keep moving because there is no time. But in the midst of all these things, I needed us to understand the barriers, because with these barriers, we can then use our power of effective communication, of active listening to break all those results and overcome these barriers as much as possible. Again, we have the personal biases. We all have personal biases. We all have the things that we believe. You know, there are people that naturally and normally they don't, how do I even want to put it? Maybe as a healthcare assistant, you can be assigned to take care of anybody. The person could be a homosexual, the person could be a lesbian, the person could be a gay person, the person could have preferences that don't align with you. Maybe you know that this person is transgender, and I'm attached to look after that person. Already your beliefs goes opposites in different direction with the patient. So as humans, these things, that particular act of you hating that particular action or hating what that person is, poses as a barrier already. So if you are not someone that knows how to handle these barriers and nip that particular bias that you have in the board, understanding that this person is first a human being before all these things, that these biases that you have, it will be a problem in you actually communicating actively and walking a mile or a step into the person's life. Holistically, recognizing potential barriers is crucial to ensure that communication remains effective. It is very, very important for us to know this. You have to understand the barriers that you face, and then you ensure that despite these barriers, your communication still remains effective. This is important. Hence, the training is here. So now, at this point, perhaps, like I like to say, maybe we can have, let's see, maybe we can have from you more barriers to communication that I would like to learn. You know, when I started this training, I did tell you that I am going to learn from you as well. The only difference is that I'm not going to pay you. Sorry about that. I'm not going to pay you to learn from you, but you are paying for this service. That is the difference. So I would like to hear from us, because I've talked and talked and talked. I would like us to talk. I'd like to hear from us. What are some other barriers that I may have not included in what I have talked about? What are some of these other barriers that you can share with us? Or I would also like to ask, like I said, this training is always interactive. It's always interactive. We share ideas a lot. I remember when we had the CNA training, we had the caregiving training as well. You share ideas. You can just tell us, maybe you've had issues of not being able to communicate with a particular person. You've had issues that you have not been able to break the chain. You still have some barriers. You are not really able to get across to that person. Of course, we've had so many experiences. So can someone just share an experience with us? We've been caregivers at one point or the other. I have been a caregiver severally, and I'm still a caregiver up until this moment. So I've had experiences to share. So whether you are paid or not paid, you have rendered caregiving services, either to your family member or in your workplace or somewhere. So would anyone like to share an experience with us? The floor is open, so I can pause from my talking, and talking. We can move. Who is ready to bail the cat?
Abolari Abidemi.
Oh, Abidemi again.
Okay.
Madam Abidemi.
I want
Everyone is
ma.
scared.
Okay, because me, if you people are keeping quiet like this, the next thing that will happen to me is maybe I'll just sleep. I'll fall asleep on this platform, and it will not be good. You'll be saying hello, doctor, and I'm busy sleeping. So I wouldn't want that to happen. That's why I want to hear from you. Let's set the ball rolling. Yes, Madam Abidemi, please ride on. The floor is open for
Yes,
you.
ma. The experience I had when my grandma was ill, she had stroke before she died.
Oh,
And when I
oh.
went to Lagos to take care of her, one herbalist came. I think the herbalist had already visited her, promised her to bring something for her.
For her, yeah.
And this is against my religion.
Yes, right.
So the man wanted to give me that charm that I should tie it on her wrist.
Wow.
But I told the man that this is against that I will not be able to do such
Do that,
things.
yeah.
So, when she continues to say that it's for her own benefit, it's for this, it's for, but I have to compromise my religion and do it just for my grandma. So I had to collect what the person gave me and I put it on her wrist.
Okay, so if I may ask Abolari, at the end, was there any improvement? Was there any improvement
Yes,
after that?
actually, after that, she was able to lift the ends that she was unable to lift before. So she started lifting the ends up.
Oh, okay, okay. You see,
Yes,
so that is
it actually worked, but it was against my own religion.
of course, I understand. I understand. Thank you so much, Abolari, for sharing that with us. So you see, as a caregiver, just as sometimes you have biases, that's one. Now, things that don't align with you originally and already, you see that doing that particular, carrying out that particular action does not align with you. Yes, we don't want to delve too deep into the we don't want to delve too deep into the other aspect of it, which is the religion. So, because if we want to talk about religion, we know religion, our relationship with God supersedes. But let's just bring it to what we are doing right now. You had that bias, that charm or that whatever to tie on your grandmother did not align with your religion. It's funny that someone would want that to be done, maybe looking from your perspective and all that. But at the end of the day, if your grandmother wanted that, I guess, Abolari, I guess your grandmother wanted that. Am I correct?
Yes, ma.
So she aligned with it. And your grandmother in this case is actually the patient, if we look at it in this context. So, like I also said, take into cognizance the preference of your patients. Yesterday, I tried saying something like, you don't have to superimpose. You don't have to exercise power over your patients. Okay, you want to sit on your patient. You want it to be done. It has to be done like this, and like that, like Mr. Ahmed, Engineer Ahmed said yesterday. Yes, this happens most times. You know, we may want to take for the fact that, oh, this person is vulnerable. This person is not fine. Okay, this is what I want. Oh, no. Why do you say we should tie this thing? It cannot work. Leave this place and all those things. No, in a very fine day, if it is in a hospital setting or in the Western world, that will count against you because you have to take into cognizance the preference of your clients. There are certain exceptions though, but in this case, if the person is able to talk, the person is still able to make decisions for himself or herself, then you have no right whatsoever to superimpose what you want on your patients. Many people that do this nursing and medical stuff now, they don't understand that aspect of it. Anything happens in Nigeria, I like to say, anything happens in Nigeria, and it can just be overlooked and we move, yes, like we like to move. But when you look at the Western world, you maybe places like UK, US, you go to practice this, there are stringent measures, there are rules you have to follow, and there are things they look out for. So you must ensure that you don't superimpose, no matter how tempting it may look, because it can be tempting. Really, it can be tempting sometimes. You may just want to do it and move because time is not there. I just want this thing to be done like this. No. it will count against you. It's important. Centered, person-centered approach is what we should look at. Look at the person. Center on the person, what the person wants. Let the person do as much as possible what he or she wants, and you only assist where possible. That is your duty, a supportive role. That's what we actually play as healthcare workers. So thank you, Abidemi. Thank you so very much. Who else wants to build a cat? At least one more person.
Okay. Good evening,
Hello, good
everyone.
evening.
Kate. Yes, Kate, go ahead.
Good evening. Okay.
Evening.
Okay, this is Kate. I just want to say a little thing concerning this particular one, unappreciated efforts.
Good,
I
good.
think it actually contributes a lot to when it comes to communication, in the sense that you made mention before, and which is true, that there is a case whereby you'll be doing something. Maybe this person is someone that he doesn't appreciate anything.
Go ahead, yeah.
Whatever you do, the person does not see it. So in this kind of aspects now, you might be trying to that your pain is okay. You understand? You are trying everything. How are you doing? I want to please be fine. All those things, but the person will not give you that listening. Feeling as if you are the cause of sickness or her sickness. In such aspects, some people will just get fed up. They'll be like, let me just give them all the nonsense. How the person is fine or not. You do whatever you want and you move out. No, there is no intimate communication. Why? Because the person does not appreciate the one you have been doing. So I think that
thank you.
Also.
Thank you. Thank you so much, Kate, for that contribution. Now, let me just say something. I've seen Flora, your hand is up.
Hello.
Okay. Sorry, please, Flora, can you just hold on, please? Before I forget something concerning what Kate said, please just hold on a little. Thank you. So, like what Kate said, can you hear me?
Right.
Please hold on. Please hold on. Let me just say something concerning that. Of course, we've had situations, we've had scenarios. You would find them so many when you delve into this healthcare setting. You will find them not only in healthcare. There are some daughters-in-law that complain that their mother-in-laws are grumpy. There are some sons-in-law that complain that their mother-in-laws are grumpy. Not even that. When someone ages, I have observed that some people, if a person that has maybe a difficult character, it gets worse when the person gets older. That's what I want you to understand, especially if you are handling an elderly person. Many times you keep trying. That's why you have to prepare your minds. I spend more time talk about this communication. Today, this one is going to take more of our time because it's an important thing. It's something that happens. There are people that are actually not grateful. They don't know how to show gratitude. They don't know how to show gratitude. And if you as a healthcare assistant, you may find yourself in such a situation, helping someone, and you have to put on your empathetic nature. You have to be patient. You have to turn your name to patience. You have to ensure that you are able to handle them because, of course, they will come. Those situations will come. And you know how frustrating it can be for you trying to take care of someone that does not want you to take care of him or her. Someone that doesn't understand that you are doing something to help the person. That is the scenario. But there is one thing I believe. I always tell people, aside the health, there's one thing I believe, that there is nobody that is difficult. I don't know why I believe strongly in that thing. Nobody is difficult. The only thing is if you still say that person is difficult, it just means that you have not had the key. You've not had the particular piece of the puzzle that will fit in. That is just it. It's just like a puzzle. You may say this puzzle cannot fit. Oh, I cannot do. Oh, I cannot. As soon as you get the very part of that puzzle that completes it and you put it in, you have a complete puzzle. You are able to, unravel it. So that's just how it is. Nobody is difficult. It's just you to have the approach as to go about it. And even when you eventually get a difficult person, then you should be able to swallow everything called pride. Even when you are angry, do away with your anger. Loosen up. Go out, take a deep breath. Breathe in, breathe out. You can clutch your fist, your hands into fist. If you have a pocket, put them in your pocket. Box your pockets. If you know that you are angry and you cannot let it, box your pockets, or go out or talk to a friend. Just take some fresh air and you'll be fine. You know, we all have different ways of cooling off. Take fresh air, come back. It's just like a husband that the wife upsets. Instead of beating up the wife, you may decide to just wear your shirts and then maybe take your car key and drive out, or maybe go out. And by the time you come back, you have gone past that anger most times. So that is how it is. So you, as a caregiver, as a healthcare assistant, you have to see how to loosen ways. Do not blame them. Illnesses, look beyond the illness. Look at the person, respect the person. Understand that it's the illness that has made that person to be how he or she is. And the person is actually going through a lot. So when you understand those things, it's easier to handle. Thank you, Kate, for sharing that with us. Thank you so much. Madam Flora, please, the floor is open for you.
Okay. My own contribution is still on the aspect of barrier to effective communication.
Okay.
Sometimes part of the barriers are customs and traditions. Although not really with experience. Yes, although not really with experience, but sometimes you come across some patients that will be saying, our custom, in our custom, you don't do that in our custom, this or that. You see that custom and traditions are part of the barriers in communication.
Thank you so much, Flora. That's a beautiful one. Thank you for that contribution. You see why I said that there are highly knowledgeable professionals here that I'm just doing a walkover, because I know we already know we are all on the same page. It's just to ensure that, yes, that we get there. That's why we are here. So thank you so much, Flora. Yes, customs, traditions too. I know people that are little, oh, it's not our culture. Oh, in our culture, we don't do this. In this, we don't do this. Yes. So as a HCA, as a caregiver too, it is important that you note, like I shared this on the platform some time ago, there is a caregiver, I think a nurse or a caregiver that actually lost her job, you know, somewhere, and it was on Facebook, it was on internet. The person, she's even lucky she wasn't sent out of the country. You understand? She did a good thing, but because she did not understand the patients, she did not understand her clients, so she wouldn't have done what she did that cost her. So understanding our patients is important. Bonding with them, connecting with them, knowing the things they want and the things they don't want, it will help us. It makes the work easier for us. It makes it easier. And who doesn't want to do a job that is easy? Everyone wants. You want to be happy doing your job. So these are some things that naturally we should carry with us. Let's go of certain temperaments. Let's go of certain things. When it bottles you up, try to loosen up. By the time we get to that slide, I'll talk about it. Try to loosen up, because of course you are a human being. You may be doing and doing and doing, and you see different things. There are cases where these people even go to the extent of maybe spitting on you as a caregiver, you know, doing any kind of thing to you. Even in the hospital setting, they just feel they're doing you one big favor, that you are working there and so on. There are some, especially if you are in a racist part, where they still believe in racism, and you are black and the person you are attending to is a white, a whole lot of things coming. So, but once you prepare your mind, that is why I took time to tell you before we started, prepare your mind that you want to be a caregiver. Please just move. Anything you see on the way, move. So far, it does not affect your safety. It doesn't affect your health. That's the thing, because you're also a human being. It doesn't affect your family. Please just take the skills, imbibe them, use them well to your own advantage. Be happy in what you do, because anything you are not happy doing, then you shouldn't be there after all. So thank you so much, Flora, for that. So I think we can continue. Do we have any other person that wishes to share anything? Can we continue? No one is responding. Oh, wow. Today is
Let's continue, ma.
Okay. Okay. I think I'll start calling names. I don't know whether it's the weather of today that is making people dull. Yesterday we were a bit brighter, you know, so maybe I'll start. Mildred, are you here? Mildred, because I've not heard your voice. What has happened to today? Hello, Mildred. Oh, no. Okay.
Mildred is not here.
Okay, so I need to be hearing everybody's voice. This Promise Mwagu, are you with us? I think I've not heard your voice at all. Just as we check students in class that are attentive. So I'm trying to see the people that are actually following. Promise, say hello if you can hear me. Some of us, I don't know, maybe it is network or maybe our systems are just there, like I said. I've seen a lot in the course of doing this training, so I've seen quite a lot. I've seen it all. And I can write a book about it from when I started lecturing. So please, let's try to respond so we'll know that we are together. Mr. I don't know if it's okay. Damilola, a lady. Damilola, can you hear me? Sadiq or Molara? Okay, I'll still be back. I'll still come back. Let's ride on so that.
Yes, ma, I can hear you, ma.
Okay, thank you. I just wanted to be sure that we are together, that we can hear. Now, let me get back to my slideshow for us to continue. Excuse me. Okay, so we talked about the barriers to effective communication, and now we want to look at active listening techniques. Maintaining eye contact, use verbal affirmations, very important. I see. Oh, did it happen like that? Oh, I see. Oh, go on, verbal affirmations. When someone is talking to you and you're like, oh, I see. Go on, is that how it really happened? It makes the person keep talking. So when you are dealing with your clients as a health care assistant, you need to ensure that you communicate. You keep communication flow intact so that the person will know that, yes, I am listening. Pay full attention, understand and empathize. This aspect is is key. Understand and empathize. Let the person understand that, oh, I know how you feel. Oh, this happened. I'm so sorry to hear this. This is so sad. It makes the person know that, oh, I feel your pain. That is practically what it means. I feel your pain. I understand how you are feeling. These are things that we need to keep doing to ensure that our patients, we value, to show them that we actually value them, to show them that we love them, and so on and so forth. Very important. Then open-ended questions. Ask open-ended questions. This is very important. Open-ended questions. How do you ask open-ended questions? These questions encourage the speakers to provide more detailed information, leading to a deeper understanding. For instance, someone comes back from work now, and you ask the person, was work fine today? The person will say, yes. That is not an open-ended question, because the person will give you either a yes or a no. But if you say, oh, how was work today? Or I hope it went well at work today. The person will now open up and start talking. Those are open-ended questions, questions that can make someone to bring out more, to dig deep. You bring it out. Ask the person, oh, how do you feel? Ask the person, how do you feel? Or do you feel fine today? Oh, yes, I feel fine. That is a very short, direct answer. So open-ended questions are questions that actually encourage people, to encourage your patient to provide more detailed information, leading to a deeper understanding of what you want to know. That is open-ended question. How did this happen? What happened? Oh, when you worked some years ago, what happened? Because most of these patients, they like to speak they like to give you stories. They like to tell you about their lives. Oh, when I was in the military, like my father used to say when he retired, oh, when I was still working, this happened and that happened. And, they will give you the details. So those are kind of open-ended questions. And when they talk, keep giving them verbal affirmations. Wow, is that how it happened? Wow, I can see. Oh, no wonder. Oh, can you go on? So all these things will lead them, keep moving them to tell you more, and you keep delving deeper. At the end of the day, you are connecting with them, you are bonding with them. It makes it easier for you to understand how they are feeling at any point in time. Very, very important. Open-ended questions. And then avoid interruptions. Avoid interruptions. open-ended questions. We finished talking about that. Avoid interruptions. This is very important. There are people naturally that like to interrupt others. Some people have it's a natural tendency, but it is a wrong thing. For instance, you are answering a call. Maybe someone is talking to you. You need to be patient. You need to wait and hear. Don't interrupt. Allow the person land. Some people will have to say, "Oh, please allow me land." Yes, that's the layman's. Allow the person land. When a person is talking, your patient is trying to tell you, "Oh, this is how I felt yesterday as I was going," and you are like, you've interrupted because you want to move, because you need to attend to another patient. Yes, but doing that does not show that you attach any value to the patient you are talking to. It does not show that you respect the patient. So communication is important, that we communicate in a way that expresses affection, that expresses interest, that expresses the fact that we understand these people. Please, I'll stop by 6:30 for us to have our break as usual. I hope I'm done with communication, because communication is the weighty module for today. The other ones, we don't have to, it's not so broad. So bear with me. We'll soon take our break so we can stretch our limbs and move around before we return. So we should avoid interrupting people. It is very, very wrong. Allow the speaker fully express themselves without cutting them off. Creates a more open and respectful dialogue and atmosphere. Also, observing nonverbal cues. You need to be aware of body language and facial expressions. Remember, I talked about tone and I talked about facial expressions. Now, this is another point where you look at the tips that you need to be able to enforce active listening and then to communicate effectively. Nonverbal cues, those things your patient is not saying, you are observing. I used to give one illustration that whenever I go to see my mother-in-law in her house, she doesn't need to tell me. I observe her nonverbal cues, those tips that she's giving me non-verbally. She's not even talking. So sometimes I go and see her sit down with her elbow on her chin. I beg your pardon, with her palm under her chin. She's sitting down like that. Immediately, I know that something is up. I'll just see her there. She'll greet me normally, but when I see her do that, I know that something is off. So these are some of the things. Maybe your patients, you observe maybe the face, you observe the attitude, you observe maybe the way she, maybe clutching the stomach. Without being told, you should know that's a nonverbal cue. It's telling you something is wrong with my stomach. So how do you see these things? You need to observe in order to know what is actually happening, so that you can know their thoughts, you can know their feelings, your patient's feelings. And don't forget, there is a two-way thing. As you are observing them, they too are looking at you, maybe telling you to do something for them. They are observing your facial expressions. Is your face contorted? Are you happy doing this thing? Especially when you have to do activities of daily living that we'll talk about when we get there. You have to do it with all happiness. You have to do it with smiles. You have to do it with an amiable disposition, because if not, if you are doing it grudgingly, you are doing it with frowns, already you have put up you've put up a situation that clearly spells that you are not happy with what you are doing, and it sends the wrong signal. It sends a signal rather to the patient. Finally, respond appropriately. A thoughtful and relevant response indicates that the listener has fully engaged with and understood the speaker. So at the end of it, you respond in a very appropriate way. You don't respond harshly. You don't raise your tone. You don't shout. You don't, things that you know that are disrespectful, you don't do it. That's why we are having this training. It is very, very important, so that we can continue to be that top person that we should be in the course of doing our caregiving duties. So now, quickly, as fast as possible, I would like to, what did I do? I'd like to crave your indulgence. I just want us quickly, before the break is over, I think this period, as soon as the video is over, I'll let us have our break and then we would talk. So right now, we are going to watch a video that will further talk about, just sit straight, relax, and let's see how it goes. Relax, take a comfortable position. Everything you need to know about communication is embedded in this video, and we're just going to watch it. By the time we come back from break, we'll move into vital signs monitoring. We'll enter another module. So are we together, please? Is everyone ready?
Yes, ma.
Okay, so please,
Yes,
I'll
ma'am.
need to get your feedback. I'll need to find out if you can hear, if the volume is audible enough. Let me know. If not, so that I'll know what else to do. Thank you. So let's go. I need your feedback.
Presentation, we will discuss the need of communicating with people. You will have the information needed to understand communication and how it works.
Okay. Can you hear anything?
Not really.
You hear me small.
Okay, so now,
We need more volume, please.
okay, hold on. Let's see. Share computer sound. Let's see if this would be better. Before I put it in slideshow, I need to know if it's audible.
Use communication skills to interact with all people in your care, influence a person's behavior, interact with families and teach. Describe cultural diversity and how culture.
Is it better?
Yes, ma.
Yes, yes.
Yes, ma.
But if we can get a better volume, now.
All right, let's see if it will be better, because network is not friendly, but we can see if it goes like this. I don't know if this will be better. Okay.
Culture may influence behavior. Recognize and respect differences among people in your care. When you knock on Rachel Morgan's door, you brace yourself to deal with this new.
Is this better?
Yes.
Not
Yes.
really.
We can hear it, ma. It's okay.
Okay. So now what I'm going to do is I'll put it in slideshow so it will be clear enough. Please just try to listen, because if you can't hear, then it is network. I've taken it to the highest it can be. So let's see. Let's start it, and then you learn a whole lot of things from this. Just stay put.
Presentation, we will discuss the need of communicating with people. You will have the information needed to understand communication and how it works. Use communication skills to interact with all people in your care, influence a person's behavior, interact with families and teach. Describe cultural diversity and how culture may influence behavior. Recognize and respect differences among people in your care. When you knock on Rachel Morgan's door, you brace yourself to deal with this new resident, who has not spoken to you since she was admitted yesterday to Morningside Nursing Home. Mrs. Morgan is just 45 years old, but as you read on her chart, you see that she often has double vision, weakness and loss of balance caused by multiple sclerosis. Sometimes her hands shake and often she has sudden, uncontrollable outbursts of anger or crying. She can no longer live alone safely. You are surprised when Mrs. Morgan says, "Come in," and are even more surprised when she looks up at you and smiles. You say, "Hello, Mrs. Morgan," introduce yourself and check her name band as you give her a firm, but gentle, handshake. "I've come to help you get ready for bed." "Thank you," she says, "for introducing me to Agnes Ryan. She is such a dear woman. I was sitting in this chair, thinking how I don't belong in a nursing home with a bunch of old people. I'm too young and I should be in my own home, with my own friends, surrounded by my own things." At that point, I had never felt so alone. I was crying, when I felt a gentle touch on my hand. I looked up and saw Agnes. Then she explained that you had introduced us yesterday when I was coming in. She said she'd stopped by to see how I was doing and to let me know that everyone missed seeing me at dinner. I was amazed. I wasn't seeing too well when I came in yesterday. And I didn't go to any meals today because I'm embarrassed about my weak, shaky arms. But I just couldn't believe what I was hearing. They missed seeing me at dinner. You tell Mrs. Morgan you're glad to hear that Mrs. Ryan stopped in to see her. You mention that Mrs. Ryan makes beautiful quilts. Do you think she would show me one? Rachel asks. You tell her yes and suggest that Mrs. Morgan ask her during lunch tomorrow in the dining room. I think I will talk with her tomorrow at lunch, Mrs. Morgan says, and smiles. Using communication to interact with others. As you read in the previous chapter, people can be hard to understand. But they do not have to be a mystery if you talk with them and listen to their stories. When you interact with the people in your care, you learn many things about them that help you understand them better. To do this well, you must understand communication, how it works, and how you can use it effectively in your work. Communication is the principle of care that you use when you follow all the other principles. You communicate to help keep people safe, to respect their privacy, to give them dignity, to promote their independence, and to help maintain infection control. Your ability to send and receive messages helps other people understand you and makes it possible for you to understand others. You may think that communication takes place only when you talk or write, but much communication takes place in the expressions on your face, the grip of your handshake, or the tilt of your head. How communication works. You probably know from personal experience how common it is for people to misunderstand one another. When you talk and someone misunderstands you, you may react by thinking, "What's wrong with her? Why didn't she understand me? What I said was so clear." Effective communication requires more than just one person talking or providing information. You tell Mrs. Morgan that she could ask Mrs. Ryan about her quilt making tomorrow during lunch. Mrs. Morgan says she thinks she will do that. You are the sender. The suggestion to talk with Mrs. Ryan at lunch is the message. You use verbal communication as the channel. Mrs. Morgan is the receiver. Confirmation occurs when Mrs. Morgan says that she thinks she will talk with Mrs. Ryan tomorrow. If these 5 elements work together for clear communication, why do people misunderstand one another? Sometimes the message itself may not be clear. Other times the sender may be using the wrong channel. For example, a man who talked to a nurse about the care his mother received became so upset that he didn't make sense when he spoke. His message might have been understood better if he had calmed down before he spoke, or if he had communicated through a different channel, such as a letter. Other times, misunderstanding occurs when the receiver does not confirm the message to the sender by telling the sender what she thinks the message means. If you are the receiver, confirm the message by repeating, in your own words, what the sender said. If you are the sender and you have to ask the receiver for confirmation, ask an open-ended question, not a closed-ended question. For example, the man who was talking to the nurse about his mother could have said, "Do you understand?" A closed-ended question, and the nurse could have said, "Yes," even if she didn't understand. However, if the man had said, "What do you understand about the situation that I just explained?" An open-ended question, the nurse would have answered by repeating the man's message in her own words if she understood him. Good communication requires much thought, careful attention, skill, and cooperation. It also has many benefits, including increased understanding among people. Choosing communication channels. As a nurse assistant, you use 3 channels of communication. Verbal communication is words spoken for the receiver to hear. Nonverbal communication includes actions and expressions for the receiver to observe, and written communication consists of words or symbols written on paper or some other medium for the receiver to read. The channel that you choose to send your message depends on the message and the receiver. For example, you would choose verbal communication to send a message to someone who cannot read or who is blind. In certain situations, you might use more than one channel to send your message. For example, you could explain something, verbal communication, and then write it down, written communication, as a reminder. Or you could demonstrate a skill, nonverbal communication, and describe what you are doing, verbal communication, at the same time. Verbal communication. Verbal communication has 2 important parts. 1. What you say, and 2. How you say it. Effective verbal communication requires that you have useful information to share, speak clearly, and express your thoughts well. When you talk with a person in your care or with your coworkers, use the following verbal communication skills. Get the receiver's attention before you start talking. If the person is doing something, and your message is not urgent, it may be better to talk with her later. Use words that the receiver understands. When communicating with people in your care, be careful about using medical terms that may not be familiar to them. Because some people feel shy about asking what you mean, they may not get the message. Choose the right volume. Speak loudly enough to be heard but not too loudly. How loudly you speak depends on how well the receiver can hear, how much noise is around you, and whether you are discussing personal information. If a person is having trouble hearing you, move closer to her. Speak slowly and clearly. Talk slowly enough to express your thoughts clearly and to give the receiver time to hear and think about what you are saying, as well as the opportunity to respond or ask questions. Be aware of your tone of voice. Listen to how you sound to be sure that your tone of voice matches what you're trying to say. Sometimes, when you are in a hurry or have something else on your mind, you say things in a tone of voice that is not appropriate for the situation. For example, if you are thinking about an unpleasant conversation you experienced with the bus driver today, you may inappropriately reflect your anger at the bus driver when you speak to the person in your care. Listen to the receiver. By asking receivers to respond and by listening to what they say, you receive confirmation that they understand your message. If they do not understand, you may have to send the message again in a different way. Wait until the person who is talking stops speaking, then begin to speak. If they do not stop, Politely say excuse me and wait 1 minute so that they may respond. Nonverbal communication. A performing mime never speaks. He or she uses only actions, nonverbal communication, to send a message. Information and feelings often are shared through body movements and facial expressions. Sometimes these actions are called body language. To communicate effectively, you need to understand two different elements of nonverbal communication: receiving information and sending information. When you look at people, you notice their facial expressions and how they hold their bodies. The information you receive from their faces and bodies affects how you interpret their messages. If you talk to a woman whose arms are folded tightly across her chest, you may think she is angry or upset. You interpret this message not by what she says, but by how she holds her body. However, her arms may be folded because she is cold. A person's background and culture also can affect nonverbal expression. For example, looking a person in the eye is a form of respect in some cultures, but it is considered offensive in others. When you receive information through nonverbal communication, ask the sender whether you are interpreting it correctly. On the other hand, you must be careful about the information you send. Sometimes you have to keep your feelings inside so that they do not show on your face. For example, when you provide care to someone who has an infection that neither looks nor smells nice, you must keep a calm look on your face so that the person does not feel afraid or rejected. If a situation really bothers you, you may need to excuse yourself, get a breath of fresh air and return. Be aware of how you hold your body and what you are doing so that you communicate the right message. For example, if you are pleased about something, make sure your facial expression, perhaps a smile, and body, standing erect, as well as your words, communicate your pleasure. The same nonverbal clue can signal many possible messages, which the receiver needs to check out. Consider the following aspects of nonverbal communication. Personal appearance. When you look professional, by wearing clothing without stains, wrinkles or holes, and by polishing your shoes, keeping your hair clean and neat and trimming your nails, you send the message that you care about yourself and the people you are with. Facial expressions. The meaning of facial expressions can vary. For example, a smile can be a sign of welcome or a sign of approval. A frown can suggest unhappiness or annoyance. The look in a person's eyes can show understanding or confusion. Keep in mind, however, that a facial expression can be affected by specific developmental disabilities where the person does not look at the person to whom he or she is speaking. In this circumstance, it is best to use other means too. Confirm the listener's understanding or feelings. Touch. A caring touch, such as a hand on a shoulder, a pat on the back or a hug, is often a good way to make someone feel special or emphasize what you are saying. However, as you know, touching is not considered appropriate in all cultures, and some people simply do not like to be touched. It is important to remember that physical touch can be very disturbing to individuals with specific neurological disorders or conditions. This is called tactile sensitivity, and should not be taken personally by the caregiver. Sometimes, because of how you feel, it is not appropriate to send a message by touch. If you feel angry, tense or impatient, you may want to grab, slap or shake a person, but you must never touch a person in this way. If something is bothering you, talk about it right away with your supervising nurse or with someone else you trust. Body position and movement. People in your care communicate how they feel physically and emotionally by the way they move, stand and sit. For example, a person who usually sits up straight may be slouching in his chair today. His slouched position may indicate that he is in pain, tired or feeling depressed. You also send messages when you move, stand and sit. Move toward people slowly so that you do not startle them and so that they do not think that you are in a hurry or that you do not want to be bothered with them. Where you stand or sit in relation to another person also is important. Every person has a comfort zone. Your own comfort zone may allow you to stand very close to others, but some people in your care may find your closeness uncomfortable and back away. Or you may need a lot of personal space, but someone in your care may think that the distance means you do not like her. Be aware of each person's comfort zone, and find a distance that feels right to you and the other person. Written communication. In your work, you often communicate by writing telephone messages for co-workers, reminders for people in your care and information for your co-workers about the people in your care. Before you write a message for someone in your care, find out whether she will be able to read it. Her ability to read may be a source of pride or embarrassment. Although she communicates well verbally, she may not be able to read because she never learned, she does not read English, or she has problems with her eyesight. To find out about her reading ability and protect her dignity, talk to her or her family members. Then, when you do communicate in writing, use the following written communication skills. Write neatly. If your handwriting is hard to read, print instead. Choose the best size and colors for your letters. If you write something for a person with limited eyesight, use large letters and a black or dark blue pen or crayon on white paper. Draw pictures. Sometimes a picture says more than words, and it communicates well to a person who cannot read. Choose simple words. Use the simplest words you can to get the message across. Be specific. For example, if you are noting the time, be sure to write AM or Prime Minister if two people with the same last name are in your care. Provide additional information, such as their first names or their room numbers. Be thorough. Make sure that your message is complete. Spell correctly. If you are not sure of the spelling, look it up or ask. Include your signature. Always sign your note so that people know who wrote it. Double check your message. To make sure that you have not made any mistakes, check over what you have written before you deliver the message. Computers may be used to communicate information about the person, to obtain your assignment or to record observations or tasks that you have performed, or even to take a nurse assistant examination. As with any piece of equipment, the more familiar you become with it, the easier it is to use. If you do not own a computer, you may be able to go to your local library to practice. If you feel uncomfortable, ask for assistance, and remember, the more you practice, the easier it will become. Whether you use verbal, non-verbal or written communication as the channel for sending a message, you want to do your best to make sure the message that you intend is the message that you send. Using clear communication when providing care.
Okay, so I don't know if, are we together?
Yes, very
Yes,
well.
ma'am.
Okay,
Yes,
so
ma'am.
I guess we've been able to learn one thing or the other from that video. Am I correct?
Very
Yes,
well, ma'am.
ma'am. All right,
Okay,
ma'am.
Yes,
so we'll
ma'am.
come back. Now we are going to have our break. We'll just have, please, I crave your indulgence. Let us have a 10 minutes break. So we'll be here 6:50 so that we'll be able to just go through the rest. This is the major thing we have for today. The others will not take us so long. Thank you so much for your patience. And
Thank you,
let's
ma'am.
go for break and be back exactly 6:50. Thank you.
Okay,
Thank you so
thank
much, ma'am. God bless you. Yeah.
So it means that my children are not inside my
All right. Okay. Hello. Hello. Are we back from the break?
Ma.
Can everyone hear
Ah,
me?
I
Yeah,
hear
Yes,
you,
ma'am. We
ma'am.
are
Abidemi,
back,
sorry,
ma'am.
we went on break. We went on break. So
Yes,
that's why you
yes.
didn't hear. I've seen your
Yes,
chat.
so
there.
we're back. Oh.
So that we can just run down, and I trust you will be, I want us to just hit the time 8. I don't want to exceed it. So we just need to progress. So like I asked before we left, while others will join us, I asked if we were able to learn 1 or 2 things from that. That video, I love it so much because it encompasses, it carries everything that's got to do with communication from the beginning up until the end. So even if you don't for any reason understand my explanation based on the communication, you'd be able to learn 1 or 2 things from the video. And I trust that everyone was able to view that. I would have loved to, like I like to do, I would have loved to maybe ask 1 or 2 feedbacks from what we learned from the video. But if we do that, time will not be friendly. I don't want us to exceed the time. However, the good thing is you get to have this video alongside your slides for those that don't hear, or maybe one thing or the other. So you can take your time and go through it. It will come in handy for you in preparation for the exams. So let's delve right into the next module that we have for this evening, and that is vital signs monitoring. Monitoring vital signs. Now, vital signs is very important as a health care practitioner to understand how to take vital signs. It's important. How do you check? What do you do? We are not really going to delve too much into this because vital signs monitoring, vital signs, how to check, is one of the topics that we used to do when we have the practicals. Like, we are really going to focus on it, God willing. So you would see how it is done practically. I told you that by the end of this training, you will have the practical experience as well as the theoretical experience that you could use afterwards, backed up with the internship you may wish to go for. So this vital signs, practically, we know checking to ascertain that you are okay. The first thing that happens when you walk into a health facility is to check your vital signs. They have to check, they will check your blood pressure, they'll check the respiration rates, it checks your temperature, your pulse, and so on and so forth. So checking a patient's vital signs is very important, because when it is done, it will reveal, or it will lead them to an indicator, it will point at something that will give them an information as to the state of a person's health. That is why it's important to check vital signs. I remember some time ago, when someone walked into the hospital, the person was like, oh, I need to reach out to the doctor that was in charge that evening. I need to reach out to the doctor. I've actually called the doctor. I don't have time to waste. And the nurses were like, no, madam, you'll get to see the doctor, but we have to follow due process. Can you sit down so we can check your vital signs? She was like, there's nothing wrong with me. I'm fine. I'm actually waiting. I just want to see the doctor because someone is actually waiting for me outside. And she just made created I don't know how to put it, right there, a form of chaos there resulting from her behavior. So, but the nurses did not budge. They still insisted that she went through the process. And when they checked her blood pressure, the nurse, the registered nurse herself, discovered that her blood pressure was very high. Now, she didn't want it to be checked. She didn't want to follow the due process. She just wanted to go and see the doctor. Perhaps, I don't know what she wanted to do at the end of the day. So why am I bringing that illustration? Vital signs is very important. And as a healthcare assistant, you are expected to know how to check vital signs, how to check and then document, record the readings of the vital signs that you have checked. That's why we have this particular module in this training. And what are the 5 very important vital signs? What you can see there on the slides: the pulse, the rate, temperature, rate, blood pressure, and the pain, and so on. Now, you need to be able to take accurate vital signs readings. That's very important. So now we want to look at what's the different vital signs that you can take. Now, for the pulse, the heart rate, it checks your heartbeat, the pulse rate of the heart. When we get to the practical aspect of it, God willing, we are going to see and perhaps demonstrate the pulse areas in the body. We are going to get to know how many pulse areas we have in the body. You are going to get to know the locations where you can have their names and the locations where you can find this pulse. Because there are some people that maybe by the virtue of the fact that maybe they are fat and plumpy, it's difficult to locate certain pulse areas, like the brachial pulse. When you are looking for that, someone that is fat, it's always a bit I don't know how to put it for the person. You cannot feel the brachial pulse. It's always difficult. So in such a situation, when there is an emergency, it's important that you know all the parts in the body that the pulse can actually be located, so that you know what to do at that exact time. Very important. So pulse measures the number of heartbeats per minute. What is the rate of the heartbeat? Remember, we said that vital signs is important so that you know the state and the condition of a patient at any point in time. So when you check, you find out whether the pulse rate is normal, whether the heart beats the normal time it's supposed to beat in a particular duration. When you check for the beats per minute. That's the BPM. How many beats per minute? There are different figures and ratio range in adults. Children is different. So once you know it, you can tell at first glance. Someone that is having anomalies in maybe the breathing or the heartbeats or something. So practically, this is the figure that we can have in this range, within this range. And then the common pulse points, we are going to look at it practically. The reason we are having this is in as much as we want you to have a grounded knowledge. So we want to have you learn the theoretical aspect so that you can have it for reference purpose, and then the practical as well, where we'll get to see these things. So we have the different pulse areas. You dissect your body into 2, you will see the pulse areas. There are many, which we are going to see when we have that. We have here, like the common pulse areas, the ones that are very common. We have the radial pulse, which is the wrists, where you wear your wristwatch. Within the wrist, you feel that. We have the carotid pulse. The neck pulse is called carotid, just close to the Adam's apple, where you have the Adam's apple. And we have the brachial pulse, which is the inner elbow. So we have these different pulse areas for checking of that. Then the procedure, you choose an appropriate pulse point, palpate the pulse, count the pulse rate, assess the pulse quality, document the findings. That is just the A to Z of the procedure for checking these things, which we are going to see. You are going to be taught how to count it. You are going to be taught how to use the stethoscope, how to feel the pulse, how to assess the quality. Is it fast beating? Is the heart beating faster than normal? And so on. And then you document your findings. You know, you are not treating. A healthcare assistant, you are not treating. You are more on the doing this other duties, so that when you document, it's based on what you have documented, your findings from the patients, that the other members of the healthcare team will now act on it. They'll leverage on that information that you have correctly documented. So that's why it's important to know how to go about these things. Okay, then we also have the respiration, which measures the number of breaths per minute to the normal respiratory rate ranges, adults, and then the children. All these things, they may sound, especially for those of us that are not science inclined. Remember, some of you that asked me, I told you that this course is not about someone being science inclined. Once you just have the little knowledge and the prerequisites of that you should have, you know, for this HCA. Because if you want to be truly a healthcare practitioner, you want to ascend the ladder, you want to get to a registered nurse, you want to get to a doctor, then you know a whole lot of work is required and a whole lot of terminologies you need to know. So, but for this, the major things that you need to know that aligns with your duty and you carrying out your duty judiciously are the things you are going to see. Now, like you can see, the temperature too, checking the temperature, 97 degrees, normal range, 97 to 99 degrees Fahrenheit. You get that, or 36.1 degrees. So all these things are things that we can. Checking temperature, you can use the underarm, you can use the ear. There is a device that you can just put, if they don't want to go the traditional method, they just take it to your ear and then your temperature can be checked. And the procedures are the same. Prepare the equipment, position the patient, which you would see when we are doing the practicals, take the temperature reading, read and record the temperature. Very important. Blood pressure, good. At least this one, most of us would because most of us, a couple of us should have the blood pressure machines in our houses. I don't want to use the big terminologies so that we will not have barriers in communication because we have people that are not health inclined. Good. So we have to take note of that too, because we are talking about barriers to communication. So, but let's take it down. Like for the blood pressure, we have the systolic and then we have the diastolic too, the up and the down. The normal blood pressure for the systolic, 90 to 120, diastolic, 60 to 80. But sometimes, I still repeat, sometimes, the last time we had a training, I think someone said, why is it this? We want to know the exact correct blood pressure that a person should have. And I did answer. I told a person, you can never have the exact. You know why? Because people are different. There are people that the correct temperature, I beg your pardon, the correct blood pressure for an athlete, for someone that is into sports, goes to the gym, maybe is into sports, is not the same as someone as what you will expect from someone that lives a sedentary life, that doesn't do things, that doesn't exercise, is not agile. There are different things. So there are different factors that influence temperature. So that's why it's always called a range. It's always called a range, so that you know that it falls within that and falls within that. That is why it always comes in ranges. Okay, we have the diastolic and this, I beg your pardon, the systolic and the diastolic. This systolic represents the pressure in the arteries. We have arteries, we have capillaries, we have veins. That's I'm delving a little bit into biology that we did in school, because subsequently the next module 2 is going to look at biology. So we have to try to bring back our memories from secondary school, when we had to deal with anatomy and so on. So now diastolic blood pressure represents the pressure in the artery when the heart relaxes and is filled with blood. That's the difference. This other one represents the pressure in the artery when the heart contracts and pumps blood out. So that's why it is taken at the same time. The two joined together is what gives you the real pressure of your blood. Now, systolic blood pressure is considered the more important number, the systolic, because it indicates how much pressure your heart or the heart has to work against when it's pumping blood. How fast is it pumping? Is it pumping normally, or is it going, or is there something? Does it have blockage, or does it have obstruction? How is the heart pumping? So it's always considered the most important. Now, we also have the diastolic too, that reflects the lowest pressure in the arteries and is an indicator of the resistance in the blood levels. Never mind, all these most of it are the medical jargons. When we actually get into the practicals, you would now see what we are talking about and looking at. But holistically, looking at both the systolic and the diastolic readings are used together to provide a detailed and comprehensive assessment of a person's overall blood pressure. So that's to say that a person's blood pressure is not assessed only on the systolic or only on the diastolic. No, it is the a combination of the two that can make a doctor to say, okay, the blood pressure is this, the systolic, this is the diastolic. Okay, we can say of a fact that this person is doing well. So these are things that they actually look at. The treatment, like I said, is going to be done by the doctors, going to be done by, but you as the HCA, you have to provide information. Remember that I did say that you are a very important member of the team, if not the most important. I don't want to sound too, if not, because anything you enter, they are leveraging on that information. So you see that from the start, you are already playing a vital role in enhancing that patient that has walked into your facility or that is under your care gets better. Very important. Not only checking that, your communication with the patient, like we just talked about, your feedbacks, the emotional aspect. In a situation, there are situations whereby you even have to handle someone, maybe that they just passed the news, sad news too. And you have to be there to comfort not only the patient, but the family as well. So you see that your job is not a walk in the park, like I said. It's very important for us to learn these things. A person that is a healthcare assistant, you play a more vital role than a CNA. Though a CNA is important, but a healthcare assistant is broader. You have a broader scope of practice. Very important. Now, when you do these things, there are times that you have abnormally high readings. Since you know the range, that's why you need to know the range. Like we will let you know practically. You need to know the range because sometimes you get abnormally high or low readings in either the systolic or the diastolic pressure. It happens. And that's because there are certain underlying health conditions that require medical attention. So when the blood pressure goes up abnormally high, based on your readings, it's sending a red flag to the other members of the team that are in the higher hierarchy, and they have to spring into action and actually know what is wrong. So monitoring these trends in this blood pressure is important over time. So that you can easily and quickly identify potential issues and then go about with the treatment. Reports to appropriate quarters for something to be done, for that issue to be nipped in the bud or treatment to commence immediately. That is very, very important for us to take note of that. Now, procedure for taking vital signs. Don't worry, we'll soon. I want to see how we can finish so we can have a little time to maybe ask questions or rub minds. But nevertheless, like I said when we started, ensure that you have your questions. You may not even have to wait until the end. Put it in the chat box. I always check, put in the chat box any contribution. I may have omitted something. And since I'm talking with professionals, you may know what I don't know. You can help me put it in the chat box and we'll talk about it. It's an interactive class. I don't like to monopolize teaching. It's not very good. So now, procedure for taking vital signs. Prepare the environment. These are things that we need to know. We don't have medical terminologies here. Prepare the environment. Before you take vital signs, prepare the environment. Let the person sit down if it comes to checking in a comfortable position that is comfortable enough for you. Let the person sit down. Very important. And then, how is the hand? Make sure that the person is comfortable. If you are checking blood pressure, let your patients be comfortable. Don't just say, oh, no time, I don't have time. Because people in the healthcare sector have seen, especially those that don't really have their onions, they don't have the tips in their finger, they don't have the proper training. They are always on the run, as in, they're always on the road. It's like Lagos. People that live in Lagos understand what I'm saying. Everybody seems to be in a hurry, as if the world is just going to come to an end right now. That's how it is over there. So as nurses, as people in the healthcare field, one thing that we should have, one particular important virtue is patience. Before we want to do anything, take your time. Analyze the situation, look at it, sit down, rest. Are you okay? Are you comfortable? Communication is important. Communicate with the person. Are you comfortable? Okay, now I'd like to take your blood pressure, your hand, can I have your hand like this? Position your hand. Keep communicating in caregiving, in giving care. Because this is giving. Anything you have to do that you are giving care, Keep communicating. Do not invade. I don't want to say invade privacy. That's not the right word, but don't superimpose what you want. Go along with the patient. Carry the patient along. It's important. As I told you, the things you learn here, people that have passed through this training, it has helped them. Even if they don't eventually end up as caregivers, I tell you, they learn a couple of things to add to what they already know that will help them in any aspect of life. Communicate, carry people along, respect people, value people, love people. I mean, bond with people that are important. I don't mean unnecessary bonding, but connect with people, especially your patients, connect with them. Give them smiles, show them that you are happy with your job. You are happy doing what actually brings a person out. What actually makes you stand out is your ability to enjoy anything that you do. If you don't enjoy it, it will become cumbersome. It will become problematic to you. So it is important that you enjoy anything you do. It's just like a teacher. If you enjoy teaching, like I said, I've taught for a long time. I started teaching in the secondary school before I went higher and academically. And so as a teacher, for instance, you value the people, you take whatever they have to say into consideration. Children, don't say because they are children, no, they are small. Sorry, I'm digressing a little bit. You don't say, oh, because they are small, they don't have opinions. No, it's wrong. Carry everybody along, hear what everyone has to say, because there's nobody that is an embodiment of knowledge. Believe you me, when you hear what people have to say, you can even learn and be a better person. That's just the way it is. You know, so even when someone comes into your facility, respect the person. Show respect. Do it with smile. Do it with joy. Enjoy it. When you enjoy doing something, it just flows naturally. It just comes out of you. It's just like the training I do. I enjoy it. I love it because I just feel this is where God has just asked me to be, in the health sector. So anything that has got to do with health, look for me anywhere. I am so passionate about it, about anything that has got to do with humanity. So that is how it should be when you decide to actually delve into this business, because it has to do with emotions, it has to do with temperaments, it has to do with that's your soft side coming out, that's your humanitarian side coming out. So if you enjoy what you are doing, you will align it to anything you do. Follow step-by-step procedure for each type, like we can see here. Record your measurements accurately, document, notify the nurses of any abnormal readings or anything you find out of the ordinary. This is very important for us as certified healthcare assistants. All right, so now, before we delve into the last but not the least, I would like to ask at this point, do we have any question? Is there any question or any contribution? It may not be a question, it may be a contribution. We still have some few slides to go and another part of biology to look at briefly before we end. So is there any question? Are we together, please? I just want to hear the unanimous answer that gives me that energy to forge ahead, please.
Yeah.
Are we together?
Yes, yes.
Yes.
Yes, ma'am.
Yes,
Continue,
we
ma'am.
are. Yes, we are.
Okay. There's a tone of voice.
So sorry, ma, that immediately we get into the vital sign monitoring, my network drop. I've been logging in, going out, logging in, going out.
Kate, I'm sorry to hear that.
Feeling at all.
I'm sorry to hear that. Don't worry. You know, we do, and the smart solutions. One thing BCC UK is good at doing is, if we are known for anything, is the ability to carry everyone along. Because of course, without you, we will not be we. Without you, we will not be there. So what I can assure you is I would have loved to go back to have that vital signs, but it's going to take our time. It's going to take our time as we are hitting 8 o'clock. But what I can assure you is you would get the slides, you get the recorded versions. And when you get them, if you have any question or any angle that you don't understand, even if it is 12 midnight, please reach out to me. I'll explain. I don't know if you feel better, Kate.
Thank you very much.
Okay. So because
Yes,
if I go back,
yes,
I would
yes,
have
thank
loved
you.
to go back, but it would take over time and it will take us out of 8 o'clock, which I know you wouldn't want. So don't worry, I am there with you all through. We'll definitely get it done. So I was saying that, do we have any
Thank you.
contribution You're welcome. You're welcome, Kate. Do we have any contribution or any question to ask? The floor is open for the next 2 minutes before we run down the last module and we go. Do we have any question? Let me ask you a ended question. Do we have any question? Yes or no? Please answer.
No question.
Okay.
It's just an observation, ma.
Okay, please do. Who is observing?
It's Mildred.
Mildred. Okay, Mildred.
Yes, ma'am.
Hey, I've not heard your voice, so I'm happy. Go ahead.
Okay, ma. And you know, when you started talking about the vital signs and how it should be taken, how patients should be treated before taking the vital signs.
Yes.
And you made mention of how they are not really like trained in Nigeria.
Some of them, yeah, that's right.
Because they know that, and some actually very good. It's not that they are, you know. So like,
yeah.
These vital signs, I still have a feeling that the process of taking it, like especially for the elderly. Hello,
yeah.
ma.
I'm with you, Mildred.
Maybe you throw more light on it, because you know most elderly patients, even when you want to take their, I'm talking from experience. When I go to the hospital, what I see, you see them very angry.
Yes.
I have seen an elderly woman that slapped a health assistant that want to take her vital signs, and the lady she became very
angry.
I are very angry, you know. So I think because if you look at the healthcare environment, especially outside the country, it's usually the elderly ones that are more particular.
That's correct.
What,
yes, you're right.
Thank you, ma. So I want you to throw more light on handling them so that we can learn. Thank you, ma.
Okay, Mildred, thank you too. You see, yes. when I started talking about the vital signs, the way we restructured our modules is in such a way that we have you take the theoretical aspect. Please, whoever has the mic on should do us justice, should put it off. Thank you. So, yes, like you were saying, the vital signs is not something that I can just talk. That's why we had the theoretical aspects where I had to talk about the range and this and that. I know exactly what you want, and I know how these vital signs will be more explanatory to meet that particular aspect of it. Don't worry. I had promised that this session, this training is packed. When we get to what I have just done is the theory. I've just told you this is the range, and you have to position the patients, you have to do this and you do that. That is what is done in the theoretical aspects. As we get to the practicals, we are going to have all these things that we are hearing, we are just wrapping it and talking about it. When we get to the practical aspect, you would see how the patient is to be positioned. You see how to communicate. Thank you for bringing in that elderly person into it. So you've just given us a tip. So when we do that, we are going to show you in particular how to do that, because that one will be showing, that one will not be talking to you. You will get to see it, how it is done, how to position the patients, how to check which one is the ideal one, how to count, how to read. Everything is just going to be very clear as the streets of London at night. So that's what you are going to actually see, Mildred. Never mind, you'll get to that place. And when we get there, I will call you, Mildred, to ask if you are actually satisfied. Because if I tell you, it's not going to make any, you just have to see it practically shown and demonstrated like we used to do when we have the vital signs. So Mildred, please, I don't know if that has helped you in any way.
Thank you so much, man. God bless. Thank you.
You're welcome.
Yes,
I'm going to recall it when we get there. I'll recall it. Thank you. So do we have any other person contributing or anything? If there is none, we still have time. So let's kickstart it.
Hello.
Okay.
Hello,
yes,
ma.
please. Yes, Kate.
Okay, please. I don't know if you can maybe use a few seconds to project that particular blood pressure. I'm actually jotting something down, but I just need a particular thing to jot down from the blood pressure. If you can project it within a few minutes, a few seconds.
Okay, no problem. Thank you. I crave the indulgence of every other person. Let me do what Kate wants so we can carry everybody along. Okay, Kate, I don't know if, okay, blood pressure, good. This is the blood pressure.
Yes, I've seen it. Yes,
Okay,
I've seen
the
it. It's
systolic
okay.
and then
Thank
the
you.
diastolic.
Don't
You're
worry.
welcome. You're welcome. So let's go so that we would meet up with time. So today and finally the last module, you're welcome.
I've seen it. I've screenshotted it.
All right. So now we have the anatomy and physiology. That's the last module for this evening. So I want all of us to put on our caps, our secondary school cap. Cast your memories back to when you were in secondary school. I don't know if you're a science student or art student, even primary school, integrated science. We still have these things there. So we want to just quickly look at this particular topic is important. We are not going to delve into it the way a doctor would, because a doctor, especially a doctor, depending on the area of specialization, will dissect and project and explain if I was giving this training to doctors. But for now, because most of us, and CHCA is actually a foundational stage for movement in the health sector. Good. So that is why it does not require you to really have the grounded knowledge in science before you can render help to someone. No, it's a professional course. So, but we want to make you understand a couple of things. Why? So that it would help you when you understand how you can treat your patients, what happens to them. It helps you understand how best you can help them when you know what happens to them. So anatomy, what do we mean by anatomy? Before I start, just pause for a minute. Look at your body, just for once. I don't know if anybody has ever done that as I'm talking. Look at your body, hold up your hand. Wriggle it around, maybe your fingers, your hand, just wriggle it around. Take a sip of water, sniff the air, hold your breath. Maybe you breathe in and breathe out, hold your breath. Now, these things that I have mentioned, they are simple. They sound so simple for us that I guess we don't even take a moment, we don't even give it a moment of thought, because you want to carry something, you can move your hand and carry. You want to jump, you can jump. You want to breathe in air and breathe out, you can do it. You can just do. So because it's easy, you can maneuver all these things. Perhaps you've not stopped to think, what makes me to be able to do all these things? What makes me move without having mobility issues? What makes me eat without throwing up? What makes me still stable in a cold situation? All these things are things that we take for granted. But I tell you, this human body, if you were to open your we are talking about anatomy, now if you were to look at your body, maybe your body now as I'm speaking to you can become a transparent object. You can see what is going on in your body. You will respect science because science is beautiful. Now, what is anatomy? Every movement that you make, every new day that maybe you sleep and wake up that you see is a result of a collection of systems that are working together to function properly. If one thing is just like a chain, if one part cuts off the chain, you will not be able to tie it around your neck. There's automatically a disconnect. So all the systems in the body move, they do their own work. They do their own work in order to ensure that the whole body can wake up the next morning. The whole body can move to a place. The whole body can sit down and listen to me as I am training, as I'm teaching you. The whole body can jump up and do exercises and do a whole lot of things. That is the beauty of science. Now, this intestine in our stomach, if it were to be stretched, you remove the intestine, remove or stretch it as you are stretching a belt. I mean, not a belt, but an elastic, because a belt does not stretch. Most belts don't stretch. So maybe you pull it out like an elastic. You would see that you'll be surprised to note that this particular intestine of yours can be as long, when it is stretched, it can be as long as a 3-story building tall. It can be as long as that. I can tell you authoritatively. So you see, now what is this particular anatomy? Is the science of the structure of the body and the relation of its parts, how one part relates to another, how your bones relate to your flesh. You understand? So that is just it. We are not going to delve that. I'm trying to make it as simple as possible because I don't want to go into the main jargons. I don't want to go into the main jargon. So we'll just look at it in the surface for this particular training. Now, as I said, now, the study of the structure of the body parts and their relationships is anatomy. The body parts, the skeleton, the bones, the muscular system, the systems of the body, how they relate, that is anatomy. And what about physiology? Because we need to know the meaning before we go. What about physiology? Physiology is the science of how these parts come together to function and to keep the body alive in the actual action, the process, what it does, what this does and what the other does. That is the physiological aspect of it. But the anatomy is the physical part and how they are intertwined, how it is structured in the body. That is the difference. It's important for you to know as a healthcare assistant to know, because if you know, it will help you to detect when you see any shift in paradigm, any paradigm shift, or you see any anomaly. It will be easier for you to understand because you already have a background knowledge of these things. So let's move to the next slide. Now, human anatomy, like you can see there, that's just a picture that I decided to put in a cross, not even the full picture, just a cross section of it so that you will understand what we are looking at. Okay, so now we are going to let's look at the next slide. Now, the body is made up of 12 human organ systems, 12. And these 12 organ systems function differently. They do different duties for us to be able to breathe, for us to be able to do the things that we actually need to do. They function. The circulatory system has its own duty, the digestive system, and the endocrine, the muscular systems. As you can see here, if you count it, 1, 2, 3, 4, 5, 6, 6, 6, that's 12 human organ systems. They do different duties. So in a cross section, why I'm saying a cross section is I am not going to delve too much into it, but it's important we have this knowledge. Why? Because a couple of us will eventually progress higher in the health hierarchy. We may want to move higher, maybe to become nurses or maybe to become eventually even doctors if we want to progress higher and have higher educational qualifications to add to what you already know. So it's like a foundation. So it's giving you an overview of what is expected. Now, this is how this body functions. We are looking at how the body parts functions. I try to make it as simple as possible. These systems actually do different things. So many that if we want to put it into slides, it's going to be. So I just took the ones that are relatable, the ones that are. So now if we let's look at the circulatory system. What does it do? Remember, we are talking about physiology of the body, the anatomy, the human circulatory system. It delivers oxygen and nutrients to cells, and it takes away waste. That's what it does. So you find out that a patient that comes and maybe cannot urinate, cannot pass out, cannot circulate, cannot sweat, all the things that has got to do with circulation, you observe that the person has a challenge one place or the other, then you know that, wow, the person has issues with the circulatory system. That is why it's important for you to have an idea of what it entails. You may tell yourself, I'm not a doctor, or I'm not a nurse, why should I? But you're as good as being one because you are in the health care environment setting. So what does it do now? It delivers oxygen and nutrients to cells and takes away our waste. The heart, all our hearts, pumps out oxygenated and deoxygenated blood on different sites. We have the oxygenated, we have the deoxygenated blood. Now, these blood vessels, how do they pump out? They use the blood vessels, the arteries, the capillaries, and the veins that we have in our bodies. So as it does this work, what part of the body helps? Everything has got to do with circulation, how blood circulates. Oh, I beg your pardon. I have made a little mistake. When we talk about waste, delivering oxygen and nutrients to cells and taking away waste, the circulatory system handles that. We get down to the digestive system, breaks down food. What does it do? It breaks down the food that you eat and absorb nutrients for energy and growth. So you see, if there is a problem with growth, if there's a problem with indigestion, you know that those things it's most likely that there is a distortion, there is a problem with digestive system of that patient. Then we go to the endocrine system that controls mood growth and development. That's what it does. It releases those hormones that deals with your moods. It releases them into your bloodstream. And this lets these hormones to travel to cells in other parts of the body. It helps control your mood. Sometimes you see people have mood swings. They are like this, the other minute they are like this. They are on this other side to the extreme, then they move all of a sudden to this side to the extreme. It affects the mentality and it controls the moods of people and development. Very important. So we are just going to run through them. It's not something we should delve extensively into because we are not actually involved in the end, how do I put it? Like, we are not doctors, so we are just going to stay within the limits of the training so that it don't get too ambiguous for us. But nevertheless, we are just going to see how to do it, to dissect it as much as possible, because we just need to have the basic knowledge, the foundational knowledge, or the basic knowledge of how the systems work. So the immune system protects the body from harmful substances. Like, we know that immunity already. When your immune system is down, you know you are prone to having different issues, you know, from time to time. When you have a weak immune system, it helps you. That's what your immune system does. It helps you to it protects your body from harmful substances. It helps you to stay healthy, to stay strong. Good. So if germs enters your body, it could make you ill, and it is the duty of your immune system to fight with those illness germs that have entered your body one way or the other. Then we have the integumentary system too, that protects you from infection, from injuries, from the external environment. Okay, as well as the respiratory system pulls oxygen for respiration. Respiratory, your body cells gets rid of carbon dioxide, which is you send out, and then gets in oxygen. It has to do with your respiratory system. So we also have other systems too, the lymphatic system that deals with the fluid level in your body. Your fluid level, if you are dehydrated, this is the aspect that handles it immediately. Maybe you don't have enough fluids in your body, or the fluid is in excess. There are people, they say don't drink too much water because of one illness or the other. This is where the lymphatic system comes into play. We have the muscular system too. That's what gives you mobility. That's what gives you poise. That's what gives you stability, gives you posture. You can stand up straight, you can sit down, you can speak, you can chew, your jaw can move according to the rhythm of what you are eating, because your muscular system is actually doing its own job. So you see, all the systems of the body function in their own ways to ensure that the holistic, the total person is well and healthy. So if you walk into the hospital, or you walk into a facility, or you as a healthcare practitioner, you know these things, it's easier for you to know exactly where you have a challenge. If you know how the system works, even without you even seeking a doctor, you know that, oh, my bone, I cannot sit upright, I cannot do this. Yes, it may be that they have other underlying challenges, but that issue of your bone clearly tells you that there's something wrong with your skeletal system. There's something actually wrong with your muscular system. So you cannot sit down well, you cannot move properly, you are feeling pains here and there. So you see, doctors do a whole lot of work. And then we go to excretory system. Good, excretory system. Excretory system is anything that helps you to send away waste, that helps you to send away things that are not needed. Excrete, send it out. Your excretory system deals with that particular aspect. And then the reproductive system too, that we already have in the body. We have the female reproductive system, we have the male. All the major duty is to allow you for the production of offspring, for you to put, maybe for the women to put to bed, and for the men to do what they know how to do best. So holistically, that is what this whole training is about for this evening. We don't have too many slides remaining. We just have one last slide, and that is the end for today. So now we want to look at the very last, which is homeostasis. That is the very last we are going to look at this evening. I want you to take time and understand this homeostasis. It's very important. Why? As is important to you as an individual and is important to you as a healthcare practitioner also. Now, what do we mean by this homeostasis? You can see the slide there, but I don't want us to read from the slide because you are going to have it. Let me give you an illustration. Let me bring it to the barest minimum so that you would understand what we are trying to talk about. Now, homeostasis is something we need to know because it talks about your body's natural instincts to be able to automatically control whatever happens in your system. That's homeostasis. Now, homeostasis is like your body's internal thermostat. Most of us can relate to that. If you have a thermostat in your house, or you have a thermostat, I think that's, or you have a stabilizer, like some people call it, in your house, when there is light, when there is maybe influx of electricity, maybe there's been no light, and power holding, or wherever you are, I don't know, just brings light. Automatically you have light and the bulb's light, it just comes. You find out that no matter the power of that light, there is a natural tendency for the power of the light to be regulated, to return to be normal when you have a stabilizer or you have a thermostat. I don't know if I'm making sense. Our bodies have their own original cushioning effects of certain things. It is only when those barriers are broken, those cushioning effects have been tampered with, that we become ill. But if not, if we are still healthy, it means our condition can deal with certain things. We can handle certain situations. We can handle certain illnesses that will come to us. Now, just see this hemostasis as the body's way of maintaining a stable environment despite changes around us. Why is it important? Because our body are constantly facing changes. Our bodies face different changes, temperature fluctuations, physical activities. Even now, you sat down for how long to listen to my training? That's an activity, you understand? So your body has to adjust, your body has to adapt immediately for you to be able to sit down and listen to me. So homeostasis allows us to adapt to these changes. Your natural body tendencies helps you to adapt. You're at work, your supervisor needs this, you can sit up, tidy up, and get it done. Your body adapts to it, especially if you are okay. When you are broken, you are ill, that you are maybe admitted in the hospital or a patient is there are certain things that go wrong with the body's natural tendency to adapt to changes, which is the homeostasis. So how does this work? Let's look at it. It works, for instance, let's look at, let me give you a scenario that will make you understand. Let's look at maybe temperature control. Imagine that you are outside, maybe on a very sunny day, a very hot summer day. Your body temperature starts to rise because of the sun, so you are hot. Your body temperature starts to rise. And when your body temperature starts, you start to feel that heat because of the sun. Automatically, your body mechanism, which is the homeostasis, automatically what happens is that it cools down that temperature. It brings it down and your body begins to sweat. That's why when you are in the sun, you begin to sweat. It's just the homeostasis of your body. It just responds to the fact that your body is very, very hot. And so you need to sweat out the heat, and so that you will be relaxed and you cool down. It will reduce the temperature, reduce the heat. So now, to cool down your body sweats, and this sweat evaporates, which helps lower your temperature. If it gets too cold, if you're in a cold place where there is AC, maybe very cold, your body automatically, you begin to shiver. You don't tell your body to shiver. Your body shivers to react to the cold that is already there. You understand? And so your body shivers. Why do you shiver? Why does your body go into shivering? So that as you shiver, that shivering is bringing some form of heat, giving you a little leverage in that cold situation that you are. So our body automatically has that homeostasis. Okay, let me look at another scenario. Let's look at maybe blood sugar regulation. After you eat a big meal, your body sugar increases, your body sugar level rises. You eat a big meal, understand? Your sugar level, your glucose certainly rises. what is the response? You have what they call pancreas in your body. And what does it do? Your pancreas releases insulin. When that sugar is too much, automatically your body releases insulin, a hormone that helps your cells to absorb glucose for energy. So that time insulin is released. You don't tell your body to release it. It's the homeostasis. It's the natural internal tendency for your body to control itself and ensure everything is balanced. So your blood sugar now comes back to normal. When that insulin changes the sugar to energy, you see that you don't have that sugar issues again. All these things I'm saying, take note that is for a healthy body. For a healthy body, for a body that is healthy. That's why you see some people have diabetes. It means there is a challenge somewhere, their homeostasis, there is a problem with it. The barrier has been broken. So their body mechanism cannot fight against this particular challenge. Hence, the person lands in the hospital. So it is important that we know these things. Very, very important. Okay, if we want to say maybe fluid balance, let's look at maybe fluid balance. After you do exercise, you sweat a lot. It's normal. When you jog, you do all those heavy exercises, you sweat and you sweat a lot. When you sweat so much, what happens? You lose fluids. You sweat a lot. That water, you are sending out fluids. What does your homeostasis do? What does the body natural tendency do? Your body now senses this loss that you've sweated, you've brought out a lot of sweat. It senses this loss. And the next thing you do is, please, can I have a bottle of water? Can I have a bottle of water? You drink water because your body mechanism has given you a signal and your homeostasis has been able to put every condition, put your body mechanism, your condition to be in a balance. So you need to drink water so that you'll be able to restore that part that has been sent out. So holistically, it is important we know when someone's homeostasis is challenged, you have a problem, your internal body will not be able to use the natural tendencies to fight against all these things that I'm telling you. As such, you land in the hospital. That's why we have so many patients in the hospital. It's important you know this, at least as a healthcare practitioner. Hence, we have it here. So now, receptors, we have what we call receptors. And what are receptors? They are sensors that detect changes in a body, changes in temperature, blood sugar levels, and so on and so forth. The part of the body that processes this information and sends signals to respond is the brain. This brain that we have, that's another part. When we talked about anatomy, I think there is something wrong somewhere. Nobody has even told me. That means we are not even looking at the slide. Please, has someone seen anything wrong on the first line? Homeostasis is a major unifying term in. Has anyone seen it? Please, who is going to correct me in that first line that I have seen now? Hello, are we together?
In anatomy, physiology.
Okay. It's supposed to be anatomy. You see, typo
Anatomy
error.
and physiology.
So forgive me. I just saw it now. Surprisingly,
No
forgive
problem.
me for that. I need to correct it because I'll send these slides out. Just bear with me. Let me just do something on that. Anatomy. Okay. Anatomy. All right. Anatomy and physiology. Thank you. So, back to what we were saying, we are almost done. I know some people are already sleeping and they are wondering, oh, this Dr. Dorothy, we are not cut out for all this. But it's important that we know it. It's just good for us to know it so that we'll be well-grounded for anywhere we face. So now, finally, let me give you a real-life example, which I've already given you. This is the last slide and we'll soon wrap up. It's not even up to the time I promised, but we'll wrap up. So now, think of homeostasis. Just like a home heating system, people have, like I talked about it before, a thermostat, a home heating system. Now, a thermostat detects the temperature in the house, most of us that have it. If it's too cold, the thermostat signals the heater to turn on. If the house is too cold, immediately the thermostat sends a signal to the heater and the heater comes on so that the house can get some warmth. That is how it is. And if it is too hot, it signals the AC, the air conditioner, to cool things down. So it's just that. That's the body natural thermostat. That's the homeostasis of the body. So homeostasis is essential for our health. By understanding how our body maintains balance, we can appreciate how our lifestyle choices, like our diets, like our exercise and hydration, affect our well-being. Remember that your body is always working hard to keep you in balance. So if you have, at the end of this training, just go and take a glass of water, or take or just take a bottle of water and just cool down and tell yourself thank you. Tell your body thank you, because if you know the work that your body does for you to keep you well, you will thank God for giving you the body. So I think with that, we wrap it up for today with this homeostasis. Anything that you don't understand, we have the slides, like I had said. You can go through them today, God willing, but I'll plead, like I like to plead, and I like to show respect to my students, that I'll plead that you give me till tomorrow morning, you'd have the slides. Because right now, my body homeostasis, I wouldn't want anything to go wrong, because I'm almost hitting the saturation point. So I'll just need to take a break and just to lay my head and rest. So by tomorrow morning, God willing, between now to tomorrow morning, I'll drop the slides for you. So you will have everything. You go through, reach out to me, anything you don't understand, and then do justice to it. Because remember, our exams will definitely come, but it's as simple as ABC. The exams that come with these health courses from the board is not something that is very, very, that will give you, that you have to break a head for. So long as you follow the teachings and you follow the slides and you go through everything, is as simple as ABC. So on that note, we have come to the end. I don't know if we have any question or any contribution. We still have some time. You can write on and contribute. You add or you subtract. Thank you so much. Yes, yes, please. Who was
Madam Dorothy.
Yes,
Good
please.
Good evening, ma. There's one
Good
thing.
evening.
There's one, let's say like a word they gave to us when we did hemostasis in school. They told us that if you want to remember the tricks in hemostasis, you should always remember input is equal to output. That's
okay. Input is that's good. That's very correct. Input is definitely equal to output. Thank you. I think that's
balance.
That is a Madam Ogweze. because these things are not medical jargons to you because of your field. That's very, very correct. Input is equal to outputs. Like I used to prefer, I don't know, it depends on what you want. I think people learn in different ways. I prefer to use it just like a thermostat. I like to relate it to that, but that's very correct. Input is equal to output. Thank you so much, Madam Ugeze, for that. You are always filled with sharing your side with us as we do this training. Thank you. So, do we have any other person, any other contribution? Because I know we are tired. I'm not hearing people's voices today. Today did not really give me that ginger, that vibes that I always need. That's because maybe people are tired and they wish to retire. They say, oh, all these things Dr. Dorothy is saying, what is even the meaning of all these things? I just want to be a caregiver. Oh, what's happening? Jesus. Okay. Thank you. So do we have any other question or any contribution from anybody? Nobody is even responding. Everyone is tired. Are we together, please?
Yes, ma'am.
Okay.
Yes, yes, we are with you.
All right. Our men, I don't know today, it's like, hi, the work really made them feel so, our men, it is well with us. Thank you so much. We have come to the end of today's training, and we are going to have our next session next week, Wednesday and Thursday, God willing, God being with us. If we don't have any other thing to say, to ask, in case you don't remember, because I've been going through the chat box and I've not actually seen anything written there. Okay, the volume is low, and okay, I've not seen any question. Like, I like to get questions when we are actually going through the slides. I like people to ask questions, you can type it in the chat box. I get to look at it, but I haven't seen any. So maybe later when you get the slide, there may be people that may wish to ask more questions, maybe to clarify certain issues or even to contribute. That's why we have a platform. That's why we have the registered participant platform. Even if I'm not there to respond, any of the admins will respond, or any other knowledgeable person in the platform will respond that has knowledgeable in the sense that maybe has an answer to the question you have asked. You can share, the person can share the answers there. It's a forum where we try to connect and build that bond, at least from now till when we get certified, and even after, this relationship still lasts. So thank you very much. I appreciate everybody for having stayed this far. I want to say a very big thank you to you. And what I will tell you, the bottom line is that your effort is never futile, because you are going to create a mark. You are going to actually impact in the lives of people. So this particular training and your effort is definitely not futile. Thank you so much. As I hand over to MJB and Andy Smart Solution to take over from there. Thank you.
Thank you, ma'am.
You're welcome.
Thank you, ma'am.
Thank you, ma'am. I appreciate your teaching, ma'am.
Thank you. Thank you too.
Thank you very much, ma'am. God bless you.
Thank you.
Bless
God
you
bless
too.
you.
Bless everyone.
We love you.
You're welcome.
You're welcome.
Okay.
Okay. Love you too. Love you too. Love everybody. Good night.
Good night.
Good night.
Good night.
Bye-bye.
Bye.
Bye, bye, mommy. Bye.
Bye, doctor. See you next week.
Thank you. Have a lovely week and do rest. Yeah. Thank you.
So good night.